Perfect. So I wanted to ask you a little bit about COVID and some of the work that you're doing around, I guess, getting us through COVID. There's an initiative that you've launched. It's called Masking Together Challenge. It has 3 ongoing challenges in the fight against COVID, and I'll mention what those are, and then I wanted to get into a bit about how the organization started and how you're working toward these objectives. The first one is to curate and distribute personal protective equipment. The second one is focused on providing safe sanctuaries for frontline workers across the Greater Toronto area. And the third one is to support research for a vaccine. Again, these are kind of focused on the Canadian side.
Mm-hmm.
I wonder if you can speak to, oh, you know what, even before I get into that, I wanted to say congratulations for being nominated for and winning the Arbor Award, which is a very prestigious award by the University of Toronto, and it's given for sustained contributions to specific academic units, such as faculties, colleges, or institutes, or for broader contributions to the university at large. And so you've recently won this award, so I wanted to say congratulations. I know it's a huge achievement, really recognizing a lot of the super important work that you're doing. So congratulations on that.
Thank you.
And I wonder, I mean, COVID it's been around already for, how long has it been in the Western world?
9 months.
9 months. Yeah, there we go. So people are getting sick of hearing about this thing, understandably so, but ironically, it's actually getting worse. It's not getting better. So I almost sense that there's fatigue, and there's kind of, people are sick and tired, and people have been impacted dramatically because of COVID. So how do you keep this going? How do you keep people interested and engaged and donating and volunteering their time and everything around this?
I would say to you that right now, I'm in my phase 2. We did a big push, and we let it kind of go quiet in the summer. So it was very easy. I had a patient just about to start chemotherapy. She's in her 30s, ended up with stage 4 cervical cancer because she didn't have a primary care physician, and it was like it got mixed up between her not knowing that she really needed to get it followed up on, and the gynecologist, between that and the GP not following it up. Next thing you know, she's stage 4 cervical cancer, and I say that because she went out public to talk about it for me. So she's having chemo and radiation. If you think I could find her a mask, so a mask, a box of masks. I just wanted a box of masks. So my buddy, who I've known for 20, 30 years, is in the medical device business. And I'm like, Benny, can you get me a box of masks? I just need one box of masks. If you think I could get a box of masks during COVID, you can't buy yourself a medical box of masks. So he jokingly said to me, I don't know, I'll ask my friends who are in this business. And he's like, yeah, I found you masks if you want to buy a carton, like a cart of like a whole 100 million of them. I'm like, what? And he's like, yeah, well, that's the numbers. You got to do this in millions of masks now. Like, this is now something that's beyond me. And I was like, I don't know what are we going to do with 1 million masks? He goes, you have a Rolodex, you can figure this out. Next thing you know it, I'm learning about how you can get masks in, how Health Canada regulates, which is a barrier to entry, how foundations can't take masks because they have to do a curation of the masks to make sure that the hospital can take them. To give her one box of masks, like, I mean, this is crazy. So I thought to myself, okay, well, let's just try and start buying some from my patients and then gifting to the hospital. Then they don't need to buy them, and that's how you get around it. So next thing you know, I asked my patients, and very lucky that I have very kind, generous clients. And in a week or two, I think it was 3-4 weeks, we raised $200,000. And then now, in order to get it going, one of my clients said to me, let's work with this. Why don't you work with U of T and I'll throw in 10 million. I'm looking and I'm like, are you joking me? No, you're serious? Now we're into these bizarre numbers. And we were getting masks to the University of Toronto Medical School, which then distributed it. And then they also paid for hotel rooms because we didn't know at the time whether residents, which are doctors who have passed their exams as a doctor but training to be specialists, we didn't know whether they should go home. So it was best that they just stay in a downtown hotel. And the hotels were very kind. They were like $99, but you still need to pay for them. So some of that money went towards that. And the third bucket was to do the research, which they predominantly funded to get Canada to do some of that work. And I'm very proud to say that as of like about a month ago, the University of Toronto Medical School is now called the Temerty Faculty of Medicine because they donated $250 million. Let me just explain to you, that is $250 billion to endow the University of Toronto's medical school, my medical school. And I'm totally humbled to be working with such family of the Temerty team. And it's just crazy. So now I have other family foundations working with me, and we have to yet announce it, but it will be providing masks to not-for-profits and shelters in Canada. And the third phase will be that we're going to try to get more of my clients and companies to download the COVID Alert app, because I think we have to start being more proactive, not just as government. They're going to do their own thing, and at this point, don't ask me why we don't have rapid tests in Canada. I don't have an explanation, and any explanation they give to me is not valid at this point. And personal responsibility. Some people are doing it, some people are not. So the vacuum is corporate Canada has to pick up the slack now to do carrots and sticks, but we'll talk about that as a different conversation. But when I announce it, I'll let you know.
Sounds good. So I looked into the Temerty donation to the U of T Faculty of Medicine, medical school. I think I got this right, but it's the single biggest donation, corporate donation in Canadian history, I think.
Ever.
Yeah, that's incredible. I couldn't believe the number when I saw that. I was like, oh my God.
Yeah.
Incredible.
Yeah, Doreen, it's one of those kinds of things where, as a student, you go to university, and this building has this name on it, this hospital has this name on it, this is this and that. But it's very different when you actually know the family and you actually understand how they think. And Mr. Temerty and Mrs. Temerty founded an energy company, still own it. And they're looking at green energy. So I get them, and this is just crazy stuff. They were in technology. So I think that they are the right types of people, with their daughter now running the Temerty Family Foundation, to make sure they stick handle the University of Toronto's medical school into the 22nd century, like over time with the money. So I'm quite excited about it, and I get to see it as, the tree is planted. Let's see what it grows.
I'm looking forward to seeing and hearing a lot more about that as well. So, big question here, slightly political, slightly not. Is Canada doing everything that it can to help solve the COVID problems?
Absolutely not.
What do you think
Absolutely not.
Can be done better?
So here's what I knew from the Masking Together Challenge. This is what I learned. When I was going to look for these masks, and I had so many, that when they found out, both provincial and federal governments across Canada, that we potentially had access to 5 million of them, they offered to help us make sure that we could get them out of China and fly them in and give me 100 boxes or so I needed, and they would take the rest of it, and the University of Toronto get like whatever amount they wanted, and the rest would go to the provincial and federal government. The reason we needed to do that was we had no masks in Canada. We have no capacity to be self-sustainable to make masks. And today, I don't know where we're at, and you'll see a National Post article, it was hijacked by Americans who outbidded us, and we got outbidded, including the Russian government, because the shipment that we had was a piece that was going to fall off a huge order that was going to go to Europe, the EU, and to Russia. So I'm not going to name names. You are now doing an American podcast. So happens that was the weekend that everything went to the United States by a directive. And they were paying 4 times the value of the mask overnight. So now it's international piracy of a box of masks that saves your life. I'm not sure we still have enough masks, okay? Now, we invested in a company called Spartan, and they're still not Health Canada approved, and we approved an Abbott test that's American. We have rapid tests that are approved by the World Health Organization, made in Korea, that's been pending Health Canada approval since March, because I know that because we determined as a group of scientists and medical practitioners that that was probably one of the better rapid tests. No, nothing. We launched the COVID app, and 15% of Canadians have downloaded it. And I can tell you that as a former chief wellness officer of a major telco and speaking to senior telco people, if the federal government mandated that these three major telcos, Bell, Rogers, and TELUS, had to just put the COVID-19 alert app on everybody's phone, it would just be done like that. You couldn't delete it, just like you can't delete on your Apple phone certain things. Just be on. I don't know why we're not doing that. We stopped contact tracing. That app should be helping us contact trace each other. So am I a little passionate and pissed off about it, Doreen? I am certainly am.
I remember stories pretty early on, I think maybe even March, April, even. It came out pretty quickly, but people were stocking up in the US. I think there were a lot of stories like this. So buying PPE off of Amazon, stocking up, and because the news was already out, people obviously, like anybody a little bit of e-commerce savvy, understands that this is going to become in short supply. So they loaded up on cheap supplies, and then they ended up selling them at like, I don't think it was like 5-fold. No, it was probably like 10 to 100 times the actual cost of whatever they bought it off Amazon. So tons of these stories kind of came out. So yeah, a lot of strange things happen for sure. Yeah, I mean, we could spend a whole segment just talking about response to COVID.
Somebody will do a story on that, because there was definitely winners and losers in the PPE game.
There were, yeah. I think quite a bit has come out about that. And I mean, people got a lot of flack for it too. But the crazy part is that, no, I mean, whoever kind of stand to make a profit, a lot of them ended up just continuing, it was kind of business as usual. Once you had the stock, why not? I think there was a bit of retaliation in the sense that, and I feel like this kind of gets completely around the point of doing it to begin with, but I remember seeing a video or hearing a story. Some of the people that ended up stocking up weren't able to sell. I think they were either blocked or something happened, and so you'd have like garages of like PPE, and they couldn't sell, they couldn't distribute it. Forget the price for a second, just like they couldn't distribute it because nobody wanted to buy at a certain price. It's almost like, I don't know what the business incentive is around that, but anyways, it was a bit of retaliation. So really complicated things happening. But in Canada so far, whenever there is a bulk supply of PPE, Are providers, frontline providers, are they prioritized for getting this stuff before it gets distributed to general public?
Dorian, I think we'll know in about 2 months whether there's a shortage of supply in hospitals. I don't know the answer to that question. I don't have an inside track on it. I know that one of the Canadian manufacturers in Quebec started cranking up masks. So I think this time around our PPE system is probably okay now, but the rapid COVID test not being anywhere so that hospitals can use them at the front door, so that I can use them in front of my front door, so that schools can use them with their nurses, workplaces can use them with public health nurses or occupational health nurses. Certainly nursing homes, I'm waiting for them to show up. They said they're going to move the rapid test to nursing homes.
The three main kind of objectives of the initiative you're running right now. So one of the big ones that I don't think gets enough attention, but it's the piece about being able to provide support to frontline workers. They're in the hospital all day, and they're exposed to so many different things. So for any of them that if you have a family, do you want to go back home and risk infecting everybody else? One of the initiatives is around partnering with hotels, I believe in the GTA, and just providing a bit of a safe haven for people who are residents or doctors to go and quarantine, basically. Yeah,
it's still going on, and it's good. It's good. So those kinds of programs are good, but I think the next one is to try to get COVID alert app going for every Canadian, and my campaign to get rapid COVID tests to people.
How close do you think Canada is to getting a vaccine, developing something, an effective vaccine?
That's another political game. I've come to realize that it's complicated and it's beyond my understanding of science and politics. And I don't know how much of it is which. Like I've said to my clients, don't expect to see a vaccine in Canada till October, November, because we are not manufacturing them in Canada, and it doesn't look like there's a vaccine candidate coming out of Canada in the first round. And so we have to wait for the world to give us them.
I mean, in fairness, I think there are like hundreds of initiatives that have popped up now, not just in Canada, North America, Europe, Asia, all working on this thing, not collaborative. In some cases, collaboratively, mostly everyone's kind of competing for funding around this.
But Dorian, how many companies make vaccines? There's only a few, and they're going to make their own first before. Say I discovered a vaccine, and I had my own little study to make it work. It's stacked against the little guy trying to do a clinical trial, right? It's stacked. So it's not that simple. So certainly Canada has been in the forefront of vaccines, but we are not in the forefront of manufacturing vaccines. So we're still going to have to go find a factory that's going to stop the line so that the J&J one or the Lilly one or the whatever is going to stop their line and put in a Canadian vaccine to manufacture some of it. It's just like, I don't see how that works.
Yeah, I think part of the picture is just the roles have to be divided up. So it'll be biotech-like labs or companies that are creating sort of the candidates, and then in terms of testing, so going through clinical development and distribution, manufacturing, that'll have to be the bigger players / government stakeholders to come in to do that. But it's still a long way to go. I mean, I haven't been keeping up to this as closely as I probably should, but it really doesn't seem like anything really definitive is in the pipelines, generally speaking. Hopefully it is. So I could be wrong. Hopefully I'm wrong, but we'll see. Only time will tell. We shouldn't hold our breaths. That's for sure.
You'll turn blue.
Exactly. Yeah, very true. Unfortunately, very true. And there are spikes happening across Europe, across North America, and other. I think Asian. I think China's been doing pretty well, as I understand it. People actually listened, and it's kind of.
No, they did. Did you not see some of the videos where they literally welded their gate because they wouldn't they wouldn't comply, so they welded the door.
Oh, really? I know it's a lot more strict, but like as a whole, it was there was more compliance regardless of the approach.
Yeah,
they tend to have.
And we've agreed on that it depends on the government that you have, the type of government, that would determine how compliant your population is going to be.
So Dr. Chen, this has been a very insightful and enlightening conversation, and an entertaining one, I should add as well. I wanted to turn it over to you if you have any final thoughts or final ideas or anything you'd like to share before we wrap up. I think we covered everything I wanted to initially in the short time that we have.
No, I think you did a great job, Doreen.
It's been wonderful. Thanks so much for coming on the show. I really appreciate it again. And I wish you all the best in your work with the Executive Health Center and Bespoke Wellness Club. And I look forward to hearing a lot more about other successes coming out of those centers as well. Thanks so much.
Thank you, Doreen, for your time and asking me to do this with you. It was fun.
My pleasure.